Hey guys, it's Dr. Mona Gohara. Welcome to another episode of Dear Derm. Laser stands for light amplification by stimulated emission of radiation. I know that's a complete mouthful, but it is that's what laser stands for. It's actually a light source that delivers treatment to the skin. Now, what can lasers do? Lasers are pretty tremendous machines, I gotta tell you. So there's a lot of different dermatologic conditions or cosmetic concerns that lasers are appropriate for. Hair laser is one of them, and there are a lot of lasers out there that target hair removal. People who struggle with rosacea and broken capillaries, there's a laser called the pulse dye laser, which is great to target blood vessels in the skin. Lentigos or sunspots, those are brown spots on the skin that come from too much sun exposure, not enough sunscreen. There are lasers also that can target those. There are lasers that can target acne scars by increasing the collagen production in your skin. There are lasers that can help you rebuild and build collagen in your skin for purposes of anti-aging by using heat to build collagen in the skin. Lasers have the tremendous capability to really do a lot of things that are non-invasive but can make a big difference for your skin health and your skin appearance. So saying lasers is like saying ice cream. Like there's a lot of different kinds of lasers. The kind of typical laser that we all know, the OG laser, they work by targeting something in the skin called a chromophore. A chromophore is either pigment or blood. So it targets either, brown pigment or blood vessels. And so that's why it's so important for brown and black skin people to be very careful about their laser treatments, because we don't want it to target your normal skin tone. We want it to target the area of concern that they're working on. Let me give you an example. That I got hair removal. I have brown skin. Well, my hair is brown, my hair is dark brown or black too. So that laser targets in on the hair's color to get rid of it. But I certainly don't want it to target my own skin color or get rid of that. So the hair color is a chromophore. But we have to be very careful about using devices that are appropriate for my skin so it doesn't damage my actual brown skin color. Way back in the day when, it's just like laser treatment for brown skin really was hard because there weren't treatments that actually could target the color chromophore without harming the skin. And I think that there's so many different advances now, different wavelengths of lasers that have a shorter contact with the skin that make laser treatment much more amenable for brown skin because of the changes in the physics of the actual device and the obvious recognition that we need to be able to treat, more than 50% of the population. Not every dermatologist will have a laser in her or his office that is necessarily appropriate for your skin need, and some don't have any lasers in their office. So if you feel like a laser is an appropriate treatment, if you've researched it, if that's something you're looking for, I would certainly suggest calling the dermatologist's office before you make an appointment or looking online at her or his website to make sure that they have it. Secondly, there is a question of accessibility as it pertains to price point. Some things may be cheaper, such as, if you have one little broken blood vessel or like a couple little broken blood vessels on your face that you want to get rid of, that may be something where in my neck of the woods that would cost something like $275 or $300. Insurance does not cover laser treatments most of the time, even if it's for something like acne scarring and rosacea. But if you're doing like a full facial, rejuvenation, that may be something that's more than $1,000. So it depends what you're treating. It depends how large the surface area is, and it depends what kind of laser and healing time go along with the procedures. But laser treatments are not cheap. You have to learn about who's administering these treatments because, you know, people can certainly get burned, they could scar, and they can have permanent damage. So please, please, please choose a board certified dermatologist, a plastic surgeon, or a MD who has been trained and qualified to administer these procedures. Now, it may not be that the doctor is actually doing the procedure. It may be an RN, a physician's assistant, an APRN, or nurse in the doctor's office. That is totally fine. I trusted my registered nurse in my office to do my laser treatment, but it should be within the purview or the confines of a doctor's office, because they set parameters and they'll be the ones to know what laser is appropriate for you and what settings on the laser are appropriate for you. You should not have a treatment without consulting with the doctor first. Thank you so much for watching this episode of Dear Derm. Don't forget to subscribe to Well+Good and leave us any comments below. See you later.